My name is Dr. Karen Slota. I have been a chiropractor for 24 years.
I'm Dr. Ahmed Alawat. I'm a physical therapist. I've been practicing for about 7 years now.
Dr. Rosemary Patansky, 21 years in practice. My background is physical therapy. I am double board certified.
When I try to explain to people who don't know what RPT is, and I say, it's a robotic arm that works on muscle tissue to help lengthen the muscle tissue back to its normal position. The robot is a great complement to what you can provide your patients. I definitely use manual therapy techniques in addition to the robot in my practice to get the best possible outcomes.
As a chiropractor, I thought I can fix myself. And unfortunately, due to the nature of my job and how physical it was, I actually tore my psoas.
Getting into those deeper spots, I manually do that on my patients, and I know how difficult that is to get my hands in there and how long it takes for something to release, and there's nothing better than that machine to do that. I would recommend RPT to any of my patients or friends before they tried anything surgical.
In the early stages of my therapy, I said, I need to have this in my practice. I found a new passion, and I was excited to bring RPT to my patients.
I'm Dr. Chris Mercado. I'm a chiropractor, and I've been practicing for almost 2 years. So after my first therapy session on the robot, I noticed a difference in the way I walk. I felt like it was more even. Before the therapy, I was leaning towards a specific side. We actually have the RX 2600 in the chiropractor that I'm working at. After getting robotic precision therapy done, they do feel a lot more loose. They are actually easier to adjust, and even in their everyday lifestyle, they feel an improvement in their range of motion, in their pain, and they can go through life a little bit easier after getting this done more often.
I'm Dr. Talia Najarian. I have been in practice for 10 years, and I opened up a clinic right out of school. It's a private practice. It's taxing over the body. Over the years, I've had 4 surgeries since I've been in practice in 10 years, 2 knee surgeries, 2 wrist surgeries, and the robot would have been extremely helpful pre and post. When I have patients that come back from their RPT session, the body is easier to work with. Things are kind of already warmed up. I would say the robot helps to realign the bone structure, take some pressure off the joints, which then makes joint mobilizations a lot easier. What leads clinicians to stop practicing is burnout, and often physical burnout. And so this takes a lot of the brunt force away from you doing your job and allows you to put the effort towards other modalities. For someone that isn't in pain, there's definitely hope to feel better. I think a lot of the time in my practice, we have people that are at a dead end. There are no other options, and this is definitely another option.
What brought me into RPT was many years of low back pain. I was actually diagnosed with spondylolysis, and I sought therapy at many different areas, clinics, physical therapy. Nothing really resolved my symptoms. And when I found RPT, it only took me about 2 training sessions before I had complete resolution of my back pain. It's been about 5 years since I've had any treatment for my low back pain, and I've been pain-free since. And as soon as the machine was placed in that area, it was almost immediate relief. And as soon as I stood up from the training, I thought it was a miracle. The RX 2600 is an excellent tool for pre-surgical optimization as well as post-surgical rehab. Patients who are painful post-operatively are unable often to go through formal physical therapy, whether it's because of pain or inability to do the motions that are required. And RPT through the RX 2600 has been an excellent tool, and I've suggested and actually prescribed many patients to come here, and they found great relief. I see countless people on a daily basis, and pretty much every one of them I can find muscular imbalance. I think RPT is an incredible option to restore balance to a population of people that the majority of which are imbalanced.